Hello everybody, my name is Dr. Emery Pitcel. I am the owner and chiropractor of Rothrock Chiropractic and Rehabilitation. We are located in State College, Pennsylvania. If you are a patient of ours and you've been experiencing some neck pain, you have likely been given the McKenzie cervical and thoracic exercise packet. And if you aren't a patient of ours and you just found this video, we hope that this exercise is helpful for reducing some of your neck pain. Now, in a previous video, we went over how to do properly retractions. For some patients, either initially we figure out they need to be progressed, or for some patients, we figure out over time, hey, we've gotten better. Maybe we've gotten to about an 80% better and we plateaued. And how are we going to get that last 20% of improvement? And that's where this next exercise comes in really well. On the exercise packet, this is the third one on the first page called Retractions Plus Extensions. In red bold, it says wait until you are instructed to progress this exercise, because if you work into it too soon and you have an inflamed or more acute type neck, this movement is going to be too aggressive and too forceful. Now, to kind of demo why we do retraction plus extension, I first need to start with a little bit of a show and tell demonstration. So if I start here in a neutral spine and I want to go as far back into extension, which is tipping my head backwards as I can, that's about as far as I can go. So not bad, it's pretty good movement. But watch if we do our retraction exercise first, sliding back, and then extend. Hopefully you see how much further that allowed us to get our neck all the way back into extension. So this exercise is a two-part piece. First, the patient needs to slide into retraction, and then they let that head fall right back into extension concept. Think of it as this: the retraction is the plane going down the runway, and then we're just taking off right from there. Because what some people do is they retract and then they lose the retraction while they extend. Well, that's just the same as doing retractions from here. But if you retract and then let the head fall back from the retracted platform, full on 100% end range extension stretch at the cervical spine and upper thoracics. To add a little bit of a progression, what you could do is retract, let the head fall back, and do a small little head shake no. That allows the muscles to sink a little further back when I shake my head no. And come in back, little no shake, come back forward. Like all exercises in here, pain tolerance is so important to respect and follow. If you're coming back here and you get to about there and that's your 4 out of 10 pain, but I could go to here and it's going to hurt like a 6, 4 out of 10 is the cap. Don't push it any further than that. So much like the retraction exercises, these are going to be best indicated if we have diagnosed you as having a cervical disc injury, whether that's with radiculopathy into the upper back on the arm or just a disc problem. Uh, Generally, we're looking at cervical strains that can respond pretty well to this. Some of our tension headaches might do a little bit better with this full-on movement. But again, it's kind of really good for when we've maybe plateaued or maximized our care on retractions and we need a retraction plus an extension. Usually if we start you working on this, it's still going to be helpful to work on retractions because there's time and place we're doing this with that, i.e. driving in a car, so that way you don't ram into the person that's right in front of you. There's still going to be times where that exercise is a lot more appropriate than the full exercise progression. So we hope that this was a helpful review for our established patients going through this packet, and hope it kind of guides you into doing the exercises effectively at home. If you are part of the general population, not a patient here, and happened upon this video and you found it helpful for relieving neck pain, we're happy for you. But make sure you like, comment, and share the video to others that can benefit from seeing this. Until next time, we appreciate you for watching, and take care, everybody.